Welcome to the New Retina Radio Journal Club with Vit Buckle Society. I'm Yoshihiro Yonekawa, adult and pediatric retina surgeon at Wills Eye Hospital in Philadelphia. And so for VBS, I serve as the chair of the academic programming committee. And this is a new collaboration between VBS and New Retina Radio. And education's always been at the core of what we do at VBS, from our exciting annual meetings to educational websites like Vit Buckle Academy and many other educational activities. And that fits right in with New Retina Radio's mission also. And one of our goals for these radio journal clubs is to summarize and talk about new and hot papers in our awesome field of retina and discuss it in clinically meaningful ways and to have fun while doing it also. So today, I'm very excited to be joined by our superstar panelists who are young but worldwide experts in retinal imaging. So in alphabetical order, we have Dr. Marion Munk from University Hospital in Bern, Switzerland, 6 hours ahead of us, and faculty at Northwestern University in Chicago. Thank you, Marion, for joining us all the way from Switzerland.
Hi, Yoshi. Thank you very much. I'm really excited doing this podcast today.
All right. And next we have Lejla Vajzovic from Duke Eye Center Derm. Thanks for joining us, Lejla, and for all of your support for VBS over the years.
Thank you, Yoshi. It's a pleasure to be here.
And last but not least, David Chu from Wills Eye Hospital and Mid-Atlantic Retina in Philly. He's on the VBS IT committee also. And David, I know how it's like to be all the way at the end of the alphabet all the time. So welcome to the podcast.
Thanks so much. Thanks for having me.
Okay, so the title of today's paper is Local Anatomic Precursors to New Onset Geographic Atrophy in Age-Related Macular Degeneration as defined on OCT. And the authors are Pasricha et al. On behalf of the AREDS2 Ancillary Spectral Domain OCT Study Group. And the one and only Cindy Toth from Duke is the senior author, and Emily Chu from NEI is also a co-author. And this was a really nice paper that was published initially online ahead of print on December 18th, 2020 in Ophthalmology Retina. So we're going to kick it over first to David Chu, first to summarize the premise and the methodology of the paper. David?
All right, thanks so much, Yoshi. It's a pleasure to be here. So this is a stellar paper, and I really enjoyed reading it. This paper is a OCT ancillary study from the AREDS2 clinical trial, and it enrolled 488 participants, and they studied 488 eyes over a 7-year period. And what they were looking for out of the OCT data is biomarkers that would predict future development of geographic atrophy as graded on color fundus photos. And out of the 488 eyes, they actually were able to identify 62 patients who did develop geographic atrophy at a set time. And based on their very extensive longitudinal data, they looked back 2 years, 1 year, 3 years, and 4 years prior to the development of GA and asked the question, can we detect biomarkers found on spectral domain OCT that would actually predate and predict the geographic atrophy? And what's interesting about this study is that in addition to what's been done in prior literature, they looked specifically at localization. So they looked at areas that they knew would eventually develop GA and say, is there incipient or nascent biomarkers that would be there? And they performed a matched comparison against localization elsewhere in the macula that they eventually knew would not develop GA, and say, can we detect any statistically significant differences between these two areas? And Duke has been at the forefront of developing biomarkers that they've validated over a series of many papers over many years that include the following. So they have a customized in-house algorithm that's probably one of the most advanced feature-specific algorithms. And they're able to select regions of interest that they know are going to be developing GA and a matched region of the same size. They're looking for things like the volume of the RP and drusen complex. They're looking for abnormally thin areas, abnormally thick areas, and those are sort of the the quantitative measurements they're able to produce. In addition to that, they're also grading for the hyperreflective foci, presence of OCT reflective drusenoid structures. They're looking for hypertransmission. They're looking for discontinuity and attenuation of various bands, for example, the ellipsoid zone, the photoreceptor layer thinning, and also the external limiting membrane. So there's a wide panel of different features that are looking for, trying to detect at all any of these differences that may be present and are different whether in the regions that are going to develop GA and the regions that are not. So I think it's a very interesting premise, very interesting study.
Thanks for the awesome summary of the really well thought out methodology, David. Lejla, can you now tell us about the main findings of this paper?
Yeah, I think I echo that. I think methods were exceptionally done. And as a result, we have interesting findings as well. So compared with control regions, and that's kind of the unique aspect that David pointed out, the GA regions had significantly greater drusen volume, higher presence of hypertransmission, higher presence of hyperreflective foci, higher presence of OCT reflective drusen substructures, and then greater loss or disruption of photoreceptor zone, ellipsoid zone, and RPE. Associations with photoreceptor zone thinning and interdigitiation zone loss was also seen. And lastly, authors concluded from these results that evolution of GA is preceded by early local photoreceptor changes and drusen accumulation that can be detectable 4 years prior to GA. So I think these are very important kind of early biomarkers for us to see.
Great. So the authors found a number of biomarkers in OCT predictive of GA formation. So biomarkers, it's certainly like a buzzword these days. A lot of people like using the term. It's sexy and cool. It gets you funding. But these authors are super legit. They don't even mention in the title. They just do it. And so before we go to our break, Marion, what's your quick take on your data, your initial reactions?
Yeah, so as already outlined, I think the intriguing thing here is really that they look at the localized predictive parameters and not only on general predictive parameters over a long period of time. And what is also, I think, very interesting is that despite the fact that we know that complement 3 and complement 5 inhibition really leads to a slowing down of the geographic atrophy progression, a lot of experts really believe that it's just too late to treat patients when the geographic atrophy already has developed. And we should rather move into trying to identify patients who are at high risk for GA development and try to treat these kind of cohorts. And actually these kind of parameters and these predictive biomarkers actually give us a chance to identify these patients at risk. And it may also help in terms of patient selection and finding the right population for future clinical trials. But of course, also it offers a lot of interesting potential endpoints for future clinical trials here.
Great, fantastic. Thank you for your thoughts. We're going to be right back after a quick break now. And when we return, let's talk more about this paper in detail and also about geographic atrophy from a clinical standpoint. Welcome back, everybody, to the New Retina Radio Journal Club with VBS. I'm Yoshihiro Yonekawa here with Marion Munk, Lejla Vajzovic, and David Chu. And we're going to discuss the paper on OCT biomarkers predictive of geographic atrophy that we started discussing in the first half. So dry AMD papers can potentially be very interesting or very dry. Hope you like the dad joke there. And but I felt this paper was pretty awesome. And first, Lejla, what did you like most about this paper? I feel like we often have certain attachments to really good papers for a reason. Like, what was it that made you feel, oh, this was an awesome paper?
Well, I will admit I'm a little biased because it's obviously coming from Duke Group, and I know how stringent they are in terms of analysis of the data and the quality papers that are produced out of that group. So I think that set aside, I think like we mentioned earlier, the fact that we're analyzing focal area that leads to GA development, I think it differentiates this from all the other kind of papers out there, and really truly looking at precursors or biomarkers, to use that word, is very helpful. And to have this data identified even as early as 4 years out, I think it's crucial as well. So it gives us an idea how we can in the future target treatment of GA development and potentially modulate that.
Marion, how about you? Favorite things about this paper?
Yeah, so I'm not biased. And I agree that I think the methods used here are really valid, and that's a big strength of the paper. And also the large cohort of patients and the long follow-up really allows us to identify the changes. And I think beside the changes, which Lejla has already pointed out, this longitudinal analysis also allows to really see that actually in these areas which develop geographic atrophy, they showed a high dynamic, especially especially in all these kind of RPE parameters found. And I think this is also something which you can only find out if you really have longitudinal data analysis to look at these data.
Definitely agreed. So Marion, conversely, what do you think are some limitations and what would you like to see analyzed in future studies? So you need to sort of criticize our friends and mentors, Cindy Toth and Emily Chu, some of the biggest names in our field. Tell them what's missing.
Okay, don't kill me, but I think, and this has also been mentioned in the paper as a potential limitation, I think it's very important because it doesn't allow you to have a positive predictive value of these parameters. So what it means is actually that you know which areas develop geographic atrophy, but you don't know how many areas are actually present who show the same parameters, but who did not develop geographic atrophy. So you're now found with a lot of different morphological features, which are on the other hand hard to assess when only looking at the OCT scans, when you're not using machine learning or AI or any statistical model, and you don't know the positive predictive value. I think this is a limitation.
Yeah, it's such a great point. I'm going to spare Lejla from critiquing her colleague, Dr. Toth. So David, your thoughts, any limitations of the paper?
Well, I think it was really interesting that I think this paper was one of the in a limited few that actually presents statistical analysis. And I think that one future area that they could extend the statistical analysis is to perform a multivariate analysis to see, we have a huge collection of these biomarkers and many of them were shown to be associated with future development of GA. But, if there was a way for the paper and the data to guide me on and be able to figure out which of these things should I be looking at most, which collection of 2 or 3, and potentially even to create a risk score or something like that. I think things like this have been done before, but just based on this new concept of localization and being able to extend that multivariate analysis, I think that would be super interesting, super helpful.
That indeed, yeah, would be very interesting. So, David,
I will add to David. Sorry, interrupt you for a second. I think he brings up an excellent point. I think coming up with a scoring system where these biomarkers can be used is going to be crucial in care and our clinical care of the patients. Right now, we may be identifying these markers in the OCT, but there's not a way of us quantifying it and anyways understanding what that means truly for the patient. So scoring system or quantitative way of us understanding it would be crucial.
I agree. Being in busy practices, we're not good at scoring and, finding every little detail, but in the new era for artificial intelligence, this will be right for that kind of application. So David, how will you take the information from this paper and apply it to your clinical practice? Or is it a paper that you kind of read, find interesting, and then you toss out?
No, I think it's definitely something that has translational use for the clinics. I mean, I think that when you're talking about this really high level, very investigative, cutting edge analysis as was presented here, I think the first place you might see something is, again, in investigative or clinical trial applications where you really have the time, the manpower, and the specialized imaging analysis, software analysis to really be able to, hone in and find use for this. So you might find it first in those applications before you find it in a widespread, everyday clinical application. But the future, I think definitely, as has been alluded to a lot, is to create a risk scoring model or like a severity score or something like that, where I can take an OCT scan in the clinic and then I can, be able to tell patients, well, there's a prognostic element to this. There is a treatment analysis, or you may be, you may be a better candidate for clinical trials based on this information. I think that would be very helpful.
Thank you, David. Great points. So Lejla, how will you take the information from this paper and apply it to your patients in clinic?
Thank you, Yoshi. Great question. Currently, my management is not going to change because treatment approach to our dry AMD patients these days, unfortunately, the options are very few. But I'm super excited about data coming out of the angiogenesis and current ongoing dry AMD trials. There's lots of emerging therapies, and some of them will be studying in clinical trials in phase 3. And I think we'll have lots of exciting options for our patients in the future. So this data will be used as a biomarkers to introduce these drugs to our patients.
Yes, definitely a lot of exciting stuff in the horizon. So Lejla, stepping away from the paper for 1 second, and let's talk about your general approaches to geographic atrophy in clinic. And what do you tell a new patient sitting in front of you? Like, what's happening? Is there any hope, or are their eyes just doomed?
Yeah, well, I always like to leave it hopeful for the patient, even if the diagnosis is very severe. And yes, I bring up all the ongoing clinical trials that are paving the way for treatment of dry AMD. And I talk about the importance of using AREDS2 formula as well, I think in terms of, wet AMD onset. And then healthy diets and such, I think really following Mediterranean type diet has been helpful. So I think I mentioned the current ways that we can treat it and really leave it hopeful with the ongoing trials, because I think they will make a difference for our patients.
Got it. Marion, what's the Swiss approach to patients with geographic atrophy and dry AMD?
I think quite similar. So we try to see it from the positive side, and usually, the likelihood of losing a lot of vision is more likely in neovascular AMD. So this is the first thing I tell the patient. And also, like Lejla has already pointed out, there is a lot in pipeline right now, and a lot of very intriguing drugs, which could at least slower the progression of geographic atrophy. And of course, there's also gene therapy, which really targets different polymorphism, like CFI polymorphism, for example, which could really target a subpopulation of patients with geographic atrophy. Unfortunately, on the intermediate AMD, so in the prevention there's not so much going on. Of course, we offer all the patients the AREDS formula. But so far, the subthreshold laser therapy and stuff which was coming out, either the trials were too small in order really to show a beneficial effect, or, for example, they failed to really meet their primary endpoint.
Yes, definitely great points. Hopefully there'll be some positive results from ongoing trials in intermediate AMD also. Marion, do you have any final thoughts about this paper or GA in general?
So I think, as have been already mentioned, that I think it's very hard just for a single person to really assess all these parameters. So we will need statistical models and AI. But I think there are very intriguing other studies also out, which have shown that actually the prediction accuracy is very high in these kind of models. And of course, beside all the morphological biomarker, you should not leave behind other biomarkers and other predictive factors such as genetic typing or even metabolomic profiling in order to really identify patients at high risk.
Got it. Lejla, final thoughts?
I think I'm super excited about these findings, and as Marion mentioned, others showing the ways for us to predict progression to GA. And I feel, as I mentioned previously, the pipeline is really bright. Quite a few exciting drugs coming, and I'm just excited to have things to offer to my patients in the future. So.
Great. And David, final thoughts for you?
I just really like this paper because I think this represents in 2021 just the most advanced feature-based analysis of OCT and biomarkers that I've seen. And we're at this juncture where we're trying to figure out what to do with a huge amount of clinical data that we have. We're capturing OCTs that are so dense and so high resolution. And that's just so exciting for me. I think I think we've been saying this for a while, but I think that's really our work in the future years to be able to make sense of this data, to understand how one patient with dry AMD, intermediate AMD is different from another patient, whether that's for clinical trial purposes or for the individual patient. I think that's very important.
Great. So this was a fantastic discussion on OCT biomarkers that predict geographic atrophy in the AREDS2 OCT study. Thanks everybody for tuning in to the New Retina Radio Journal Club with VBS. Huge thanks to Marion, Lejla, David for your expertise and really fun discussion. And listeners can download this podcast along with previous and future episodes. You can follow New Retina Radio, check out Vit Buckle Society at vitbucklesociety.org. And you can also catch the video version of today's podcast on itube.net. It's a wonderful resource in our field. So please stay tuned for future episodes. Thanks, everybody.